Hello, I'm Dr. Cherry Bernardo-Lazaro, and in this lecture, I will be talking about research designs in family practice. At the end of this session, we hope that you as the learner can explain the need for doing research in family practice and identify different research study designs. Well, the examples and exercises I would give at the latter part of the lecture are from various sources. The main reference I use for this lecture is the PAFP textbook. I think not all of you like research, right? But as family physicians, why do we have to do research? As a distinct specialty who sees undifferentiated cases, we have to be updated on the breadth of diseases. Given the broad coverage of family practice, we have to be knowledgeable when we do coordination of care provided by various specialties needed for our patients' total health care. Another important aspect of family medicine is its unit of care, the family, and the recognition of social sciences as factors to be considered in the resolution of health problems. And these include the need to explore cheaper, readily available, but scientifically effective modalities of treatment for our patients. As you know, research begins with a question in mind, and we know that our research question should include a population, exposure or intervention factors, and outcome in consideration. The components of the research questions are actually the variables that we study in research. Remember these because depending on when the variables will be determined differentiates one research design from another. These are the research designs in family practice. They can be descriptive or analytical in nature. Let's take a look at them one by one. A case report or case study is the most basic type of descriptive research. It is a comprehensive documentation of a particular patient or case seen in practice. It is a detailed report starting from the beginning, following the progress, up to the end point or outcome of the case. The family physician might choose to document a very rare condition, or a very common disorder that presented differently, or a case that is very puzzling. This documentation can help other physicians who might encounter a similar problem in his or her own practice. Compared to a case report which deals with just one case, a case series is a documentation of a collection of group of patients with the same diagnosis or problem. Its purpose is to come up with a common or modal observations. It starts with the characteristics of the patients, their common beginning, their manifestations, and progress. It also contains the diagnostic tests done and their results as well as the therapeutic interventions given and the response of the patient to them. At the end of a case series, a conclusion on what is common to all patients with a disorder or disease being studied can be made. This is an important study or research which may greatly help family physicians because the results can guide them in the management of similar problem, especially if the disease discussed is a rare one. In patterns of disease study, a thorough characterization of a particular disease entity is done to establish patterns of illness. Studies under this may involve characterization of the person who had the disease, characterization of the place where the cases were seen, or characterization of the time element of disease occurrence, or all the three aspects, the person, the place, and the time. At the end of a descriptive approach, the family physician may have an understanding of why a particular disease or problem occurred and somehow have a good background of the disease. So those are the descriptive studies. Next we go to analytical studies, where you have observational studies and experimental studies. Observational studies are research investigations that attempts to establish associations between exposure factors and outcomes without any manipulation of the exposure of the subject. There are three types of analytical observations: cross-sectional, case control, and cohort studies. A cross-sectional study identifies people with or without the disease, and with or without certain characteristics at a particular point. Thus, the exposure factors and outcome variables are measured at the same point in time and with no follow-up period. In this study, there is usually no attempt to establish a temporal relationship between the cause and effect. This is what we usually do when we do a survey. What is identified at the time of study are the presence of the illness and the characteristics or exposure at one particular point in time, and this is what we call the prevalence. No temporal relationship is established, or it cannot be determined if the exposure factors preceded the outcome measure and vice versa. You may use data measures such as percentage, average, mode, and median. Case control study starts with a group of subjects with the outcome or disease and another group without outcome or disease. Then you look back in time to find the difference in exposure factors or predictor variables that may explain why the cases got the disease and the controls did not. So basically, in doing a case control study, we first identify cases or those with the outcomes or diseases in a certain population. Then we identify the controls or those without the outcomes or diseases from the same population. And we collect data for the presence of the risk factor or exposure from both cases and controls. At the end of this study, we analyze the odds ratio, which states the risk of having the disease among those who have the exposure compared to those without the exposure. Cohort studies, as the name would imply, involve following up groups in the study over a period of time. It can be to identify the incidence of the disease over time or analyze associations between the exposure factors and the outcomes. Basically, in doing a cohort study, we first identify a population without the disease, then identify a group or cohort who have the exposure or characteristics of interest in a certain population, and identify another group or cohort who do not have the exposure or characteristics of the disease. Then you observe those two groups forward in time for the outcome of interest. Later on, you will analyze the data in terms of usually the incidence or the new cases or the proportion of the population who got the disease over time. Compared to observational studies, experimental studies usually have a manipulation in the exposure factors or intervention to establish its relationship with the outcome. Randomized controlled trials and quasi-experimental studies fall under these. Randomized controlled trial is said to be the strongest study design among the primary study designs. In this kind of study, individuals are randomly assigned through randomization, as the name would imply, to two or more groups. One group would not have the intervention, and the other group could have the intervention. Then, they are observed after a period of time, and their outcomes are compared. In doing an RCT, you first select a sample from a population. You measure the baseline variables, then randomize the groups into control and intervention groups. And this part is very important in the research design. Now, at the end of the intervention, you measure the outcome in both groups and analyze the data, which include your relative risk or the risk of not getting well with the disease in the treatment group versus not getting well with the control group. If the experimental study is non-randomized or non-comparative, you have a quasi-experimental study. The investigator chooses two groups and assign each group to the type of intervention by convenience, and the outcome is compared between the two groups. You may also have just one group in a quasi-experimental study and have a before and after study design, just as illustrated here. So you have a pre-intervention, then you put the intervention, then you measure the outcome at the post-intervention. You can also have a time series design, where you have a series of measurements during the pre-intervention and post-intervention period. So for example, in the pre-intervention, you just ask your patient to do the usual diet and exercise advice you have. Then you measure their parameters at the first month, second month, third month. Then you implement your intervention. And again, you can measure the outcomes at the fourth, fifth, and sixth months. So this is a time series design under quasi-experimental study. Having discussed the different analytical studies, let me show you this algorithm for choosing an analytical research design. The study designs mentioned are all primary study designs, meaning their results were obtained from individual subjects. When you pull these studies into one, you'll have a systematic review or meta-analysis. That's why these studies are called study of studies, and they are the highest in the hierarchy of studies. While most of the research designs mentioned are quantitative in nature, let me just make mention of the qualitative research study, to which descriptive studies belong. While being criticized before as lacking objective and quantitative findings, they are done to expand knowledge obtained quantitatively. They answer questions such as what, how, or why, or different kinds of questions than does quantitative research. These are some of the purposes of qualitative research. And these are the topics and approaches under qualitative research. Again, these are the research designs that we have just discussed. You have case report, case series, patterns of disease under descriptive studies. Then under analytical studies, you have observational, cross-sectional, case control, and cohort. And under experimental, you have randomized controlled trial and quasi-experimental. Now, to wrap up this lecture, are you ready for some exercises? Let's try to identify the study designs in the following slides. The figure illustrates what study. Is it a randomized controlled trial? Is it an experimental study, an interventional study, or a quasi-experimental study? While this is an experimental study or an interventional study, if you want to be more particular, the best answer would be a randomized controlled trial. As you see in the illustration, there was randomization. So the correct answer is A. The study illustrated is an example of: is it a randomized controlled trial, experimental, interventional, or quasi-experimental study? As you can see, there's just one intervention group, then measurements are done during the pre-intervention before the intervention was given, then another measurement at the post-intervention. So this is a D, quasi-experimental study. Okay, how about this case? What study is this? So it started with 117,000 nurses without cancer or CVD, and they were enrolled in this study and assess whether they are obese or lean. Then they do follow-up to see if there are any incidents of heart attack. So the clue here is they were follow-up over time. So if you answered cohort, then you are correct. So how about this study design? If you look at it, or you look at the arrows, you see that it starts with patients with breast cancer who died and patients with breast cancer who are still alive. Then they trace back or make them recall their diet, medication use, and treatment. So since you started with the cases or patients with breast cancer who died and the controls or patients with breast cancer who are still alive, then you trace back, then this is what you call a case control study. Very good. Okay, this figure illustrates what study? Is it a cross-sectional study, a case control study, a cohort study, or experimental study? So you see, you have subjects from a population and all the data, those with risk factors, without risk factors, those with disease, those without disease, are taken at one point in time. And that's the clue there. So if you answered A, cross-sectional study, then you are correct. How about the figure below? So you see, it starts with patients with cancer and those without cancer, control group. Then it looks into their history and compare to identify risk factors. So I think this is a simpler version of putting it as a case control study. How about the study design in this figure? So it starts with a population and persons without illness. They see who are exposed and unexposed, and later on, they look at if they've developed the disease or they did not develop the disease. So this is an example of C, a cohort study. Again, identify the study design, the illustration. You have the study population, then categorize into exposure as exposed, non-exposed, then compare or measure the outcome later. So this is a simpler version of a cohort study. So how about for this one? What's the study design? So you see, there's a group of workforce. Then it is said there, the workforce is split into two groups by random slot. One is given the intervention, then the other one does not receive the intervention, which is performance management intervention. Then later, the outcomes for both groups are measured. So you see, the clue here is they split the group into two by random lot. So this makes it a randomized controlled trial. Lastly, let me ask this question. Which of the following research questions could be best answered by a qualitative study design? If you answered C, how do patients feel and think whenever their attending physician is out of town? Then you are correct. I think you were able to identify the research designs well, right? So good job on that. Now you are more ready to review the basics of evidence-based medicine in the next lecture. See you there!